The Community-Based Participatory Program, or CBPR program, has been very rewarding for me. It has been informational. Through that program, I learned the key principles of CBPR research and how to apply that to my project specifically. I learned that every community has its own identity, and that as a researcher, we have to approach each community with social and also cultural humility. So the program has taught me a lot. I have grown a lot from it. I have made tremendous and lifelong connections, especially with individuals like my partner, Miss Ruth Brooks.
We are both high blood pressure liaisons through our churches, and we got connected with the CBPR program through that particular program. And then once we got connected, we found that we had common interests, and we decided that we would partner up. We would make a good team.
Overall, our interest really is in improving the health of our church communities. And so with the hypertension program specifically, we both attend different churches. They're predominantly African American churches in the Rochester, greater Rochester region. And we do know that hypertension and obesity are huge problems in those communities. So for both of us, getting connected with the hypertension study, it was really to improve the health of our brothers and sisters in Christ, and through that we kind of made that connection, and that kind of propelled us into the project that we are undertaking now. The project is entitled Faith-Based Interventions to help to support overweight and obesity rates in African American families. We are using the Diabetes Prevention Program, the National Diabetes Prevention Program, as a framework, and we are adapting it. We're, number one, hosting it in a faith-placed environment. So we have chosen one of the faith-based organizations in the greater Rochester region. We selected a community that has high rates of health disparate situations, such as poverty rate, there's a high rate of obesity, a lack of physical activity in that community. And so there's one church, which turns out to be my church, that has volunteered to participate as the first pilot church to run this program. So essentially what we will be doing is taking the first 12 weeks of the diabetes prevention program, and we have adapted it by including scriptures, we're including prayers, and also social support from other church members. And we are enrolling families into that program, and we're running it for, we're running the full entire 1 year of it, but for the purposes of the grant, we're looking at the first 12 weeks to see what impact that has on the participants. So with our project, we are partnering with the University of Rochester Center for Community Health and Prevention in learning the curriculum for the diabetes prevention program. So the master trainers from that program will be teaching the health liaisons how to conduct this 1 year diabetes prevention program.
Excuse me, it's our prayer that they will, the families, as a family, will grow together in knowing which foods to eat, how to shop better in terms of reading the labels, and also to help them with their high blood pressures and diabetes and any other illness that can be helped with eating better. Oftentimes it's kind of difficult to do things alone, but when you work together as a family, it's much easier to eat right.
And we see that in our churches. It's not uncommon to see individuals who are not necessarily biological families, but they may be church families, and they will partner together and accomplish, various feats. So we do know that there is definitely support in having individuals who are working towards the same common interests, working together on combating some of these chronic health conditions. So our hope is that with, just like Ms. Ruth said, with having these families, working together with this shared purpose, that we will see some drastic improvements in weights and, chronic health conditions and their physical activity levels, more family meals together, just a variety of different outcomes that we're hoping to see improvements in.